Good afternoon. My name is Rosemary Gadogo, RN BSN. I have been invited to talk to you today in regards to common genitourinary disorders affecting males 55 to 65 years old. I'm privileged to be standing here in front of you and talking to you about these conditions. And our main goal is that each and every one of you will leave knowing one thing or two things that can help them in case they begin to experience common symptoms. However, as we discuss this today, it's always important to follow up with your doctor if you experience any of these symptoms. Uh, the main types of disorders affecting male are erectile dysfunction and prostatic disorders. Prostatic disorders. Often after the age of 40, some men begin to show some form of cancerous prostatic disorders. The incidence of prostatic disorders increases with age. There are three types of prostatic disorders. And the first one is usually referred to as BPH, which stands for benign prostatic hyperplasia, prostatitis, which mainly is caused by an infection, and prostate cancer. It is estimated that 50% to 75% of all men over the age of 50 have benign prostatic hyperplasia or BPH. The most common presenting symptoms of prostatic disorders include difficulty in the onset of urine or urine flow with or without a low flow of urine, frequency or urgency in urinating, incontinence, and distension of the bladder. Some people also do see blood in their urine, which is also commonly referred to as hematuria. I'll begin a discussion on BPH, benign prostatic hyperplasia. In BPH, what happens is the prostate gland begins to grow abnormally, and as it grows and gets bigger, it squeezes the urethra, which is the tube connected to the bladder through which urine flows out of the body. So when this urethra is squeezed, there is difficulty in urinating, and also the urine tends to stay in the bladder. And the most common symptoms are problems with urination, hesitant, interrupted or weak stream, of urine, urgency, dribbling, where you find someone just, is able to urinate little at a time, frequency, where somebody just goes to the bathroom frequently and just urinate small amounts of urine, incontinence, and also painful urination. As you look at the picture on the right, you can see that on the urethra, there are growth, like tissue, which causes the squeezes it and urine is unable to flow. Well, on the picture on the left, you can see that, you can see the urethra, there's a clear passage where, the urine flows out. Uh, uh, if you experience any of these symptoms and you have a discussion with your doctor, there are various ways in which BPH can be managed. It can be managed with medication, surgery, or both. Common medication used are finasteride or Avodat, which work by reducing the size of the prostate. Flomax is also another medication that is used that works by relaxing the smooth muscle of the prostate and the bladder neck, decreasing bladder resistance to urinary flow. There are also surgical methods which are used to manage BPH. The one is usually referred as TAP, which is transurethral resection of the prostate, and this is also the most common type of surgery. There is also the TAP, which is transurethral incision of the prostate, and is used if you have a small prostate gland but have major blockage. Instead of cutting and removing this tissue, this procedure widens the urethra. Of course, when you experience the symptoms, your doctors will come up with a treatment plan, and the best treatment option is different for every individual. Prostate cancer. Prostate cancer is the main common form of cancer in men and the second leading cause of death in men. It is more common in African American men compared to men from other races. Greater than 80% of diagnosed prostate cancer have been on men aged 65 years old and over. It's usually diagnosed by a blood test called that measures the PSA level. Some doctors, a digital rectal examination can also be used to diagnose this, and also an ultrasound. If suspect results are found, further tests, which include biopsy, MRI, and CT scans, are done to confirm the diagnosis. Common treatments that are used to treat or reduce the effects of prostate cancer are surgery, chemotherapy, and radiation. These can be done individually or they can also be done as a combination. Surgery can involve partial or radical prostatectomy, which is the removal of the prostate gland based on the cancer type and or whether it has spread to other organs. Bilateral osteotomy, which is the removal of the testes, can also be done. After surgery, medications are also used as a common treatment. There are several side effects associated with the different types of treatments used for prostate cancer. Treatment can lead to loss of function, which varies from temporary loss of urinary control to permanent incontinence. Some people also experience fecal incontinence. Sexual dysfunction is also another condition that is a side effect or could be a side effect of treatments used for prostate cancer. This is due to the inability to attain or maintain an erection or also problems with ejaculation. It's been seen to some people that they do return to normal physiological function. This does not happen, immediately. It may take or occur over time, but some people also experience permanent dysfunction after treatment. Erectile dysfunction. Erectile dysfunction can be defined as the repeated inability to achieve or maintain an erection that is firm enough for sexual intercourse. It is estimated to affect 10 to 20 million American men. There are various causes of erectile dysfunction. Some may be illnesses, lifestyle, or a combination of both. Certain health problems can affect how signals travel to the blood vessel in the penis. This can then affect the blood flow, which make it difficult to achieve or maintain an erection. Spinal cord injury, conditions like spinal cord injury, Parkinson's disease, multiple sclerosis can cause these problems. There are also hormonal and other systematic problems that can affect a man's ability to get and sustain an erection, particularly if there are issues or problems with low testosterone. This can lead to erectile dysfunction. Certain medications, certain medical conditions are also associated with erectile dysfunction. These could be treatments, initially, it's prostate cancer or treatments used to treat prostate cancer, end-stage kidney disease, radiation therapy, surgery on the prostate, bladder, or other organs near the penis, injury to the penis, testicles, or surrounding area. Certain medications also increase the risk of erectile dysfunction. Medications which are commonly known to cause erectile dysfunction are blood pressure medication, antihistamines, antidepressants, tranquilizers, and appetite suppressants. However, it's important to know that even though some of these medications do cause these problems with erectile dysfunction, you should not discontinue using medications before your doctor gives you the go-ahead to or before a replacement is found. Treatment used for erectile dysfunction. While treating erectile dysfunction, there should be treatment to underlying causes such as diabetes, heart disease, depression, obesity, drug abuse, and alcoholism. Medications such as Viagra, Cialis, and Levitra have also been used to treat erectile dysfunction. While using Viagra, it's important to make sure you're not using other night medications, commonly known as nitrates, because these can lead to low blood pressure. Vacuum devices and penile implants have also been used to treat erectile dysfunction. We'll now be discussing prostatitis. Prostatitis is an inflammation of the prostate gland. This inflammation may spread to the area around the prostate. It can either be acute or chronic, where acute means, it's sudden onset, while chronic, it recurs, you get it every so often, and after treatment, you still get the symptoms again. Symptoms of prostatitis. The most common symptoms are pain or burning sensation while urinating, difficulty urinating such as dribbling or hesitant urination, frequency of urination especially at night, urgency, which is, an urgent need to urinate, pain or discomfort of the penis or testicle, pain while ejaculating, flu-like symptoms which usually occur with bacterial prostatitis, pain in the abdomen, groin, or lower back, also pain in the area between the scrotum and the rectum, which is usually referred as the perineum. Symptoms of prostatitis. The most common symptoms are pain or burning sensation while urinating, difficulty urinating such as dribbling or hesitant urination, frequency of urination especially at night, urgency, which is, an urgent need to urinate, pain or discomfort of the penis or testicle, pain while ejaculating, flu-like symptoms which usually occur with bacterial prostatitis, pain in the abdomen, groin, or lower back, also pain in the area between the scrotum and the rectum, which is usually referred as the perineum. Common treatments used for prostatitis are antibiotics. Also, your doctor may prescribe drugs known as NSAIDs or anti-inflammatory agents to help you be comfortable. They decrease the discomfort and the pain associated with prostatitis. I'd like to thank you for your time today and for coming out to listen to this session and education on symptoms or problems affecting male in the ages of 55 to 65. This page shows the references. If you have time, you can look them up if you need more information. And as always, this information is just meant for information. If you have any problems or concerns, it's important that you discuss with your doctor. Thank you very much.